The outbreak of COVID-19 is having a significant impact on the way patients interact with healthcare services. At this time, it's essential that you continue to seek medical attention where required. We have measures in place to continue providing safe care to all patients. GP practices are now implementing a total triage model to help safely manage and direct patients to the most appropriate care. Triage is the process by which healthcare professionals assess patient needs and ensure they're directed down the right pathway. The methods for triage may differ depending on how your practice chooses to provide services. It might involve a telephone conversation with practice staff, completing an online form via your practice website, or through calling NHS 111. Once the practice has your information, they'll then be able to best direct you to the appropriate care. The practice team may provide help and advice over the phone. They may also book you an appointment to see a clinician either remotely through video or telephone consultation or face-to-face where required. Prescriptions are normally issued electronically directly to the pharmacy to allow patients to collect them without needing to visit their GP surgery. If a face-to-face appointment is needed, you may be directed to a designated clinic determined by your symptoms. For patients who have been exposed to or are experiencing symptoms of COVID-19, local hot clinics have been put into place. These clinics have the ability to be disinfected after every patient, which reduces risk. On the other hand, if you're not displaying any symptoms of coronavirus and need face-to-face care, you may be allocated a slot at a cold clinic. Some practices may implement a similar model within their own surgery, zoning certain areas and consultation rooms as hot and cold clinics. Please be aware that you might be required to attend a different practice location than you normally do, and that some staff may be wearing personal protective equipment or PPE at this time. Practice opening hours may also have temporarily changed and will now remain open on bank holidays. Whilst COVID-19 may be changing the way services are delivered, it's still really important that you seek medical advice for any health concerns you may have. This total triage model will ensure you receive the care you need in the safest way. It's important that some immunisation programmes and other care and treatments continue to avoid ill health outside of COVID-19. You might find it useful to sign up to or log into your practice's online services at this time, where you can manage requests for repeat prescriptions. There are also a number of websites that can provide reliable advice on a huge range of symptoms and conditions. Healthcare services are continuing to do everything possible to look after everyone at this time, and thank you for your patience and understanding.